Assalamualaikum, my name is Muhamad Najmi bin Fadzil, metric number 2019291732. Today our group will present about chapter 3, adaptation to aerobic and anaerobic training. Now let's move to the aerobic training first. To see the adaptation in aerobic training, you must be involved at least 3 days of training per week for 6 to 8 weeks consistently. And as you know, aerobic training is a low to moderate intensity of prolonged exercise. An adaptation can be observed at rest, submaximal and maximal work. Now let's see some factors that will influence the adaptation. Firstly is the type and method of training, either aerobic or anaerobic. Secondly is the frequency, duration and intensity. Thirdly is the heredity. Genetic factor, like if you have dominant slow twitch muscle fibers, you can adapt easier in aerobic training. Next is fitness level and gender, and the last one is age, because optimum performance is in adulthood.
Thank you for Muhammad Najmi. My name is Johan Elmi bin Aziz from SR113D2. My metric number is 2019417268. Now I will present about the aerobic and anaerobic respiration. So the definition for anaerobic respiration is the process of produce cellular energy in the presence of the oxygen. For the respiratory adaptation, which is lung, air passage and breathing. So for the next slide is pulmonary ventilation. It will decrease at submaximal intensity and it will increase at maximal intensity due to tidal volume and respiratory frequency. For the pulmonary diffusion is unchanged during the rest and at submaximal intensity. It will increase at maximal intensity due increase lung perfusion. For arterial venous or oxygen difference, it will increase due oxygen increase attraction and active muscle and blood flow. For it will increase for oxygen extraction due to increased oxidative capacity. It will increase during submax and maximal exercise. For the next slide is lung volume. Vital capacity increase slightly. Residual volume slightly decrease. Slightly increase tidal volume. Overall total lung capacity remain unchanged. For respiratory rate, slightly reduced at rest and it will decrease slightly at submaximal intensity and will increase at maximal intensity.
Thank you, Johan. Now for the cardiovascular adaptation. Firstly is the cardiac hypertrophy. Heart chambers are enlarged, therefore increased ventricular volume, and the most important is the left ventricle size. Secondly, increased capillarization of the heart muscle. It increased in the capillary density and blood flow to the heart muscle. Thirdly, it increased in stroke volume at rest during submax and maximal workloads. SV is the amount of blood pump per beat. SV is increased because the ventricular volume is already increased. And the next point, it will lower resting heart rate. Lower the resting heart rate, the greater the aerobic fitness level, because when stroke volume already increased, heart rate doesn't need to be increased. Next, it will lower heart rate during submax and maximal workloads because the stroke volume already increased, therefore heart will contract less often. And next one, it will decrease heart rate recovery. A fitter person can recover faster than an unfit person. I think that's all from me. I will pass the slide to Imran. Thank you.
Thank you, Najmi. Assalamualaikum warahmatullahi wabarakatuh. So I'm Ahmad Hakim bin Ahmad Zamani. My metric number is 2019297472. I will continue Najmi presentation by cardiovascular adaptation for aerobic training. So aerobic training will maintain our cardiac output at rest and submaximal exercise, but it will increase up to 30 liters of cardiac output for highly trained athlete at maximum workloads exercise. So how do we get cardiac output? Stroke volume times heart rate. Next, Aerobic training will increase blood flow to the muscles by increased capillarizations of trained muscles and makes the blood redistribution more effective. So, blood volume will increase, blood viscosity will decrease, and will make the oxygen delivery more efficient. Then, aerobic training will decrease resting blood pressure, but it is unchanged during exercise due to the increase of the blood flow. It is also will increase VO2 max, that is the maximum oxygen uptake of our body, due to the increases of cardiac output, red blood cell numbers, muscle capillarizations, and the greater oxygen extraction by the muscles. Lastly, it will increase blood volume or blood plasma. With more intense level of training, the releases of antidiuretic hormone also increase. That will increase the plasma protein, also red blood volume, and will result decrease the blood viscosity.
Thank you to my friend. Hi, Assalamualaikum. My name is Hammad Haziq bin Ismail. My matrix number is 2019-416-736. Today, I want to present about metabolic adaptation in aerobic. Metabolic means the change of foodstuff to energy. First, it can delay the lactate threshold. It happens because the lower of lactate concentration and easy to remove lactate from muscle. Secondly is decreased RAR. It means the high in oxygen uptake and increasing in removing carbon dioxide. Thirdly is lower VO2 during submaximal exercise. It happens because the muscle is more efficient to absorb O2 or oxygen compared to untrained people. At the same time, muscles store more triglyceride. It happens because the muscle need immediate energy when exercise. Next, glycogen sparing effect. It means use non-carb as a source of energy during exercise. Next, increase mitochondrial density. So, the produce of ATP can be more because the greater surface of mitochondria size, and it allow diffusion to happen faster. And last but not least, increase capillary density. More oxygen can exchange due to higher surface, and it can improve VO2 max. Thank you.
For the next slide is anaerobic respiration. For the definition of anaerobic is, it will transfer energy from glucose to cell. It occurs when oxygen is not present. It transfers large amount of energy quickly. So cardiorespiratory adaptation, small increase in cardiorespiratory endurance, small increase in VO2 max. So anaerobic respiration work when glucose breakdown without oxygen. The criminal reaction transfer energy glucose to the cell. Aerobic respiration produce lactic acid rather than carbon dioxide and water. Unfortunately, this can lead to painful muscle cramp. Thank you. Now I will pass to my friend.
Thank you, Johan. So I will continue with cardiovascular adaptation for anaerobic training. So it will be small increase in left ventricle exercise, decrease in resting and submaximal heart rate. Also, decrease in resting blood pressure is greater than aerobic cardiovascular adaptation. Also, small increase in stroke volume.
Next, metabolic adaptation in anaerobic. In ATP PCR system, it can change a little bit enzymatic when we training. For example, produce more creatine, phosphate, and can cause produce more explosion. Secondly is glycolytic system. Increase glycolytic enzyme activity with training. For example, the enzyme can efficiently convert the glucose to ATP. Thirdly, increase buffering capacity. It able to increase lactate tolerance because of the increase the ability to neutralize the acidity from the body. And last, anaerobic metabolic adaptation more happen at the muscular system. That's all from me. Thank you.